A new state health department campaign is taking a different approach to substance abuse disorder.
It's using more empathetic messaging to help people move away from a hardline abstinence-only approach to recovery. Our Michael Martin has the story.
Yeah, the CDC released data just this week in regards to the number of fatal overdoses we saw between December of 2019 and December of 2020. Now, across the country, we saw about a 30% increase in the number of fatal overdoses, and here in Michigan, 16% increase. Clearly, still a present danger. And with that, the state's Department of Health and Human Services launching a new campaign aimed at keeping those who use drugs safe and alive.
I just want to shake some sense into you kids that are using drugs and think about using. So remember, don't, or else.
When you think about government-sponsored anti-drug messaging, this is probably close to what comes to mind.
Take it from me. The only way to stop abusing drugs is to stop using them.
A hardline approach to substance use that pushes aggressively on the notions of either preventing folks from ever touching drugs to begin with, or treatment in the sense of users being told to quit cold turkey, that complete abstinence is the only way forward, and typically lacking any subtlety or empathy for those using.
We know that really speaking to people from a judgmental space doesn't necessarily help them or push them to seek out those things that they may need.
Recently, Michigan's Department of Health and Human Services rolled out a new substance use harm reduction campaign centered around the idea of change at your own pace.
I always thought that it was either I have to stop using completely or I'm never going to stop.
So the Change at Your Own Pace campaign is really targeted at harm reduction and prevention and trying to really bring that human component.
Being shown love, being shown understanding has what's brought the best out of me.
And really things are about meeting people where they're at, treating people with respect and dignity, and being able to understand that one path does not solve this problem, or one path doesn't serve everyone in Michigan.
The CDC released data just this week regarding the increase in fatal overdoses seen during the span between December 2019 and December 2020. Overdose deaths increased roughly 29% across the country and nearly 16% in Michigan alone.
We recognize that the problem has increased, not just in Michigan, but really across the country.
Billboards have gone up and commercial spots are airing, focus not on shaming users for their struggles, but making resources readily available that will reduce their risk for harm or death.
HIV and hepatitis C are both preventable. Overdoses are preventable. People do not have to die.
Yeah, there are a lot of different resources that the campaign really points people to. One of those being naloxone, which we've seen a large increase in distribution of from the state through the community over this last year specifically.
Since the state opened their naloxone portal in June of 2020, they have already distributed over 150,000 kits to people across the state. Naloxone, a drug that if administered during an opioid overdose, can reverse the effects and save someone's life.
So I think it's really important that the state is putting out this messaging, and I think it's really important that we all kind of rethink how we've traditionally addressed substance use in the United States.
Stephen Alsum, executive director of the RED Project Grand Rapids, a group who has been working in community harm reduction in West Michigan since 1998, says the new approach to messaging is essential in facilitating real safety and recovery for users.
We've got to rethink the services that we've been providing to people. We've got to rethink, how we treat people. We really look at it as a basic human right that people have access to the health-related supplies that they need to stay healthy and stay alive.
Now, the idea here is to make these resources more readily available for those who use drugs, to make the idea more welcoming of using safe or eventually seeking out treatment. And we have links to these resources on our website, fox17online.com. For now, though, in the newsroom, Michael Martin, Fox 17 News.